Hi there, this is my assignment for Health Informatics 730. My topic is focused on the development of a decision support system that would help people to self-diagnose depression. So what is depression? According to the Diagnostic and Statistical Manual of Mental Disorders, depression, also referred to as major depressive disorder or clinical depression, is defined as the presence of a depressed mood or a loss of interest or pleasure in everyday activities for a duration of at least 2 weeks. There are numerous risk factors for depression, and these include being female, being young, recent childbirth, ongoing conflict, past personal history of depression, any lifetime anxiety disorders or other previous mental illnesses, family history of depressive illnesses, loss or stress, history of physical or sexual abuse, substance abuse, socioeconomic deprivation, illness causing chronic pain or disability, and the use of certain prescription medications. My rationale for selecting this topic relates to the high prevalence and large impacts of depression. A New Zealand health survey found that 14.3% of adults in this country had been diagnosed with depression at some point in their lives. That's over 500,000 people. Rates of depression are significantly higher in women than men. Depressive disorders, along with anxiety, are the second leading cause of health loss for New Zealanders, accounting for 5.3% of all health loss. For women, they were the leading cause. Additionally, major depression is strongly associated with suicidal behavior. These statistics highlight the importance of diagnosing depression and providing people with the appropriate care that they require. One of the most common ways to diagnose depression is through the DSM-5 criteria that was developed by the American Psychiatric Association. The criteria outlines 9 symptoms. An individual needs to have 5 or more symptoms during a period of at least 2 weeks to have depression. Additionally, at least one of the symptoms has to be a depressed mood or a loss of interest or pleasure. The symptoms include a depressed mood most of the day, nearly every day, as indicated by either subjective report or observation made by others. A markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day. Significant weight loss when not dieting or weight gain, or decrease or increase in appetite nearly every day. Insomnia or hypersomnia nearly every day, psychomotor agitation or retardation nearly every day, fatigue or loss of energy nearly every day, feelings of worthlessness or excessive or inappropriate guilt nearly every day, a diminished ability to think or concentrate or indecisiveness nearly every day, recurrent thoughts of death, recurrent suicidal ideation without a specific plan, or a suicide attempt, or a specific plan for committing suicide. This is a questionnaire that assesses the severity of depression. The questions used for this were based on the DSM-5 criteria that was shown on the previous slide. This assessment was developed to be administered at the initial patient appointment and to monitor treatment progress. The box on the top right corner has the score range for each level of severity. A score of 0 to 4 means no depressive symptoms of severity. A score of 5 to 9 means mild depression. A score of 10 to 14 means moderate depression. A score of 15 to 19 means moderately severe depression, and finally a score of 20 to 27 means severe depression. This sort of questionnaire, along with the consideration of risk factors, could be the foundation of an effective self-diagnostic tool for depression. Looking at the Australian version of the SNOMED CT classifications, there are 11 terms categorized under major depressive disorder. Some of the terms, such as mild major depression, moderate major depression, and severe major depression, are synonymous with the levels of severity outlined in the Severity Measure for Depression questionnaire. This is the mind map I have created for the self-diagnostic tool for depression. This tool was based on the DSM-5 criteria for depression, which is the standard criteria used to diagnose depression. In terms of the users of this tool, the primary user is the patient. This includes first-time users who want to check to see if they have depression, as well as existing patients who have depression who want to check their progress and see if their symptoms of depression have reduced, and to see if their severity of depression has decreased. An additional user is the mental health clinicians. This is because if the patient visits a mental health clinician after using this tool, the clinician can access data entered by patients into the self-diagnostic tool as well as view the outputs from it. In terms of the inputs for this tool, there will be the patient's responses to the Severity Measure for Depression questionnaire, which is quantitative data as it is a scoring questionnaire. There will also be risk factors of depression that apply to the patient. These may include demographic features, as well as personal history and experiences, and the boxes there show the examples of each. As for the outputs, the tool will provide a diagnosis based on the score from the Severity Measure for Depression questionnaire, and the result may be no depression, mild depression, moderately severe depression, or severe depression. Another output is the recommendation of the next steps. Based on depression severity and risk factors, the tool will provide advice on whether the patient should consult a health professional or not. The tool will also offer suggestions on how the patient can improve their mental health. Why would a self-diagnostic tool be useful for depression? Firstly, having such a convenient diagnostic tool may help to diagnose more people with depression and encourage them to seek help. Secondly, it would be time-saving for clinicians as they do not have to conduct the diagnostic test themselves. Thirdly, removing the diagnosing component of clinical appointments may enable clinicians and patients to have more time to discuss treatment plans and engage in shared decision-making. There are also limitations and risks associated with the use of this tool. Firstly, there could be errors in self-reporting. For example, people may underestimate or overestimate their position in relation to certain aspects of the diagnostic assessment. Secondly, this is not a standalone tool that can replace the need for a mental health clinician. And finally, there may be misunderstandings if wording within the tool is not clear. Here are my references. That concludes the end of my presentation. Thank you for watching.